Tonight on Greater Boston, I'm Sue O'Connell in for Jim Browdy. On the one-year anniversary of the attack on the Capitol, the fallout is far from over, with the threat of extremist violence as present as ever. I'm joined by two people studying the hate that's led to it all, to talk about how to stop the next insurrection from happening. Then later, COVID cases are reaching record highs, as are COVID restriction burnout levels. How can public health officials get the public back on board in the fight against the pandemic? We'll discuss ahead. It was exactly 1 year ago today that a mob of Trump supporters, white supremacists, armed militia members, and other right-wing extremists stormed the Capitol in an act of terrorism aimed at trying to overturn the results of a free and fair presidential election, at the behest of the man who lost, as the man who won addressed today.
This was an armed insurrection. They weren't looking to uphold the will of the people. They were looking to deny the will of the people. The former President of the United States of America has created and spread a web of lies about the 2020 election. For the first time in our history, a president had not just lost an election, he tried to prevent the peaceful transfer of power as a violent mob breached the Capitol. But they failed.
That they did. But what about the next attempt? Extremism experts have warned for decades of the growth of right-wing movements in the U.S., including their infiltration of the U.S. military and police departments nationwide. And Donald Trump's blatant use of xenophobia and racism to build his political brand and amass millions of followers made for an easy organizing strategy for American extremist groups, ranging from white supremacists and neo-Nazis to anti-government groups of many stripes, groups that have not gone away. So what motivates people to grow their unfounded and irrational hate of another group into armed radicalization? And is there anything that we can do about it? Joining me to discuss are Robert Pape, a professor of political science at the University of Chicago and director of the Chicago Project on Security and Threats, and Robert Trestan, the Anti-Defamation League's New England Regional Director. Welcome to both of you. Thank you for joining. Robert Pape, I want to start with you and just ask, what we're learning about the people who were arrested, who were part of the riot, and as the FBI has said, you can't have a riot unless people showed up. Many of them had no real history of violence, had no association to organized hate groups. What motivated them to be there? And are those types of people the threat that we're worried about today, in addition to those other threats that we have identified?
Right. Well, it's important to go further. They also, over half of them are business owners, CEOs, and from white-collar backgrounds. Doctors, lawyers, architects, and managers. Only 7% were unemployed, nearly the national average. So this isn't coming from the margins of society. They're mainstream. The most important thing to know about violence in the mainstream, when there's community support for violence in the mainstream, is it makes it easier to rationalize action when we think we have community support for our actions. So the more we think that the community supports the idea that Joe Biden is an illegitimate president, or that the use of force is justified to restore Donald Trump to the presidency, the easier it becomes for any one individual to act. Why? First of all, there's a public mandate now. This isn't just criminal behavior anymore. When you have a mainstream support for political violence, suddenly it's a mandate. Also, you have the idea of safety in numbers. If a mob, a large group acts together, they can believe, well, maybe I won't get caught, or I won't do X, Y, or Z. Now, they may get caught down the road, but at the time, this idea of community supported the mainstream is much more dangerous than people who may not study this subject realize.
Yeah, I want to throw to one of the people, Joshua Pruit, who was an accused Capitol rioter, had this to say.
You asked me if I do it again. I want to say yes. I don't feel like I did anything wrong, but knowing the consequences that came out of it would be the part that would make me question it. I was just a patriot out there, protesting against what I think is a stolen election.
Robert Trestan, for those of us who are members of vulnerable groups, being a woman, being a lesbian, being a member of the Jewish American community, this wasn't so shocking to some of us. However, it still is disturbing, and folks have been warning about things like this that could happen. What's your message to people who may just finally be taking this extremism and this violence seriously?
Well, the threat, it's, at one point we may have been saying it could happen here. I think it has happened here. And I think there are a lot of groups, marginalized groups, some of whom you just mentioned, who have experienced this kind of mob mentality and violence coming into their daily lives. The Capitol insurrection is one example. People experience it in different ways every day. And we saw that when you sort of drill down and look at some of the symbols for the people that were extremists. Now, we just said not everyone who was affiliated with an extremist group who was in the building that day. But when you drill down and you look at those that were, racism, anti-Semitism was fueling some of their beliefs. And I think, overall, one of the lessons here is that misinformation and lies motivates and incites people. And you don't have to be part of an extremist group or be chatting online all day long about a particular ideology to suddenly be motivated and feel that this is okay for me to act in this way.
Robert Pape, one of the double-edged swords of political organizing is that we often tell people to get involved at the local level, right? Don't run for senator. You don't necessarily have to run for president. You can run for school board. You can run for school committee. You can run for town meeting. And as we saw in Michigan, when in 2020 in October, when there was a plot to kidnap Michigan Governor Gretchen Whitmer. Many of these folks that travel to Washington are just the tip of the iceberg in some of the efforts that are happening on the local level. And when we talk about violence in the political discourse, we're not just talking about what happened last year. We're also talking about what's happening to public health officials and school committee members. Can you talk a little bit about how that's a threat to all of us?
Yes, absolutely. So also your listeners might want to know, I've been on the school board in Vermont, so I have an idea of what this local politics is like. And also you should know that when I was on that school board, and like a lot of school boards, we never talked about violence. The whole idea wasn't organized around violence. What we've conducted nationally representative surveys, multiple in the last 9 months. And what we see is that the equivalent of 21 million Americans hold two radical beliefs. One, that Joe Biden is an illegitimate president. And two, the use of force is justified to restore Donald Trump to the presidency. That is a really big thing, because what we're seeing is not just vague misinformation or so forth. These surveys are very pointed, and we're also seeing consistency. That number 21 million has not shrunk over time. What that means is there is a mass of community support for violence for very specific political goals, not just vague ideas. And this is really why it's so concerning as we go forward in the 2022 election season, because this is like a mass of dry wood in wildfire season that can be touched off by a lightning strike or by a spark. We can't predict the lightning strike or spark. What we can do is measure the size of that combustible material, and it's too big. And it's so big that, in fact, it can create that idea, as I said, of safety in numbers. You can start to get the idea that it can bubble up. Oh, maybe not everybody in my town agrees with me, but some people do agree with me. And then they will see me as a patriot, just as the person you showed on the clip. Who are they thinking sees them as a patriot? Those 21 million.
Robert Trestan, that's the number. We've been talking about these surveys in percentages, but when you actually hear what the number of Americans who believe that is, it's startling and striking. And as we enter the midterm election year, and then that immediately leads to the presidential race that begins, What's your message to folks watching about what they can do? And again, these surveys are both of Democrats and Republicans. There are more Republicans who believe this way, but Democrats are not immune from it. What's your message? What can people do to take action to defend democracy, defend our democracy, and to try and keep or reduce the opportunity for this from happening again?
Well, number one, it's a threat, regardless of your political affiliation. The concept that political violence is okay in the United States is a threat to democracy, and that's irrespective of how you may vote or how you voted in the past. And I think that message is really, really important. And we need to have a groundswell of people from across the spectrum who push back on that message. And political violence is not part of American democracy. We need to get that message out there. And we need to encourage people to participate in the process, which means voting. And it means interacting with your elected officials. It means running for office. But it doesn't mean storming a state capitol or the Capitol in Washington.
Robert Pape, it seems really hard to have this discussion about how this is a threat to all of us when at the ceremony today there were only 2 Republicans there at the congressional moment of silence. One of them was sitting Representative Cheney, and the other was another Cheney, former Vice President Cheney. Other Republicans chose to sit it out. It's very hard to communicate this message to just regular folks watching at home when it doesn't seem that the message is getting beyond party lines. Do you have any advice on how to make that go away and try and get some unity on this issue?
We have a big opportunity coming up. The very fact we're having an election means we can ask every candidate for every office in the country the same question we ask in our University of Chicago Project on Security and Threat poll. We found some Americans believe the use of force is justified to restore Donald Trump to the presidency. We can ask every candidate running for office before we vote for them, what do you think about that? What do you think about that? So this isn't about pointing fingers and getting someone to sit them down and change your mind. People are running for office. Let's ask the critical piece of information we need to know. Are they on the side of democracy or are they on the side of violence?
As we close out here, Robert Trestan, what are your reflections on last year at this time, and what are your hopes moving forward?
Well, one of the lessons is the danger that misinformation and lies and the impact that it has on people. And I think that is something we've seen in the last 12 months, that it continues to circulate, to flourish. And we need to prevent a movement of political violence in this country. So, there's some profound sadness when we look back on what happened 12 months ago. But I think there's every reason for everyone to be motivated to support democracy.
Robert Pape, Robert Trestan, Happy New Year to both of you. I appreciate your insight on this. Thanks for joining us.
Pleasure.
Massachusetts set yet another grim record this week, surpassing 20,000 COVID deaths and hitting yet another new case record. Again, confirmed new cases per day in the state have nearly tripled in just 2 weeks. And again, there's far more demand for official tests than there is availability. So while the good news is the Omicron variant is clearly less severe, the bad news is that it spread so much more quickly that hospitalizations are at near record highs and hospital staffing is around record lows because so many of them are getting infected. And then there's the school situation.
In-person learning is better for our kids, right? As a mom with 2 kids in our school system, I know that to be true.
But that's getting harder and harder to make happen with massive teacher shortages, constant uncertainty, and kids and parents fearful and confused. Didn't we see this coming? I'm pretty sure public officials were telling us before the holidays that this was going to be an issue. Though after nearly 2 years of COVID, pandemic fatigue has set in for many, and those warnings just aren't inspiring the same kind of action they used to. How can we get the message across? Joining me are Dr. Cassandra Pierre, Medical Director of Public Health Programs at Boston Medical Center, and Dr. Bisola Ojikutu, the head of Mayor Wu's COVID-19 Advisory Committee. Welcome to both of you. Dr. Pierre, I want to start with you. We've talked a lot over this pandemic, and I had the situation where folks who I had been warning personally in November that, it's possible it's going to get bad. And then when we got the news over Thanksgiving about Omicron, and then they got sick and they were like, well, how did you know this? What do we need to do to help communicate to folks when there's news and what they could potentially be doing to diminish their opportunity of getting infected?
I think that's a great question, and I think we're still trying to figure that out. I think it's clear that transparency about what we've been seeing, even in our own hospital staff, I find that talking about what we're seeing in our actual hospital, what the risks are, where the risk lay in terms of sources of infection, are really helpful in terms of galvanizing people to do what we want them to do, both in the hospital and outside. Part of that also comes in with making sure you have a trusted advisor, a trusted voice who's bringing and delivering that information. But I think the thing that really concerns me is that many people are not necessarily tuning into mainstream sources of information. They're getting it filtered through family and friends and through social media. And so I think there's a lot more to be done in terms of kind of breaching those frontiers and sending out helpful and actionable information.
Dr. Ojikutu, I'm not a math major, but I was able to pretty easily figure out that if there was a variant that was going to be much more transmissible and that more people were going to get it, even if many of them were not going to get very sick, just the math of it was going to mean that it was going to be more transmissible to vulnerable populations, to the unvaccinated, and to those who, for medical reasons, can't get vaccinated. How are we doing communicating that from a government level to folks that need to get this information?
Well, again, I think that you're highlighting a major concern that's not just related to the Omicron variants. I mean, health communication has been complicated and challenging throughout the pandemic. As the executive director of the Boston Public Health Commission, health communication has been a very high priority. We've spent a lot of time talking about vaccination and boosters and the need for our populations to be boosted. Here in Boston, we only have a booster rate of about 38%. So we're still working on it. And I think that it has been an effort that's taken a lot of time and work with our community partners, because you have very vulnerable populations who are not necessarily aware of or who have access to mainstream media per se. In addition, we're trying to keep our messages very clear and very simple. We need everybody to wear well-fitted masks indoors. We need to limit the size of our gatherings. We need to be using rapid testing as a prevention strategy or as a mitigation strategy. Other things like simply washing your hands frequently, continuing to physical distance. These are things that we've been very clear about. And I think that part of the problem here is that people are tired. This has been a long pandemic. It's been 2 years of dealing with COVID-19. So it's become even more difficult to message and for people to adhere to the guidelines and the prevention strategies that we discuss.
Dr. Pierre, I want to build off those points too, because those were all my next questions to the same degree. We're all tired and we're all confused because I imagine for the both of you, I know it's more than a full-time job to keep up on this, and you've actually had the education and the experience and the expertise to be able to understand what's happening. But for many of us, it's really hard to keep track. The messaging about the masks, which is evolving as the disease, as the virus evolves, now we should be getting better masks. And last year it was, look, at any mask is better than no mask. Well, now we need better masks. What can people do? Do you have a recommendation of a way to make a habit, a regularity, something good, like every day to check in at some news site or some public health site in order to try and get the most updated information on helping to prevent transmission?
Yeah, I think that's hard to do as well because there is so much going on. There's a lot of information and it might be difficult to know what to identify. I would say definitely I have my alarm on. New York Times has throughout the pandemic been a wonderful site and source of information and updates, and really clearly accessible and readable charts in terms of trends of vaccination, trends of infection, and what the recommendations regarding vaccine updates and new variants have been. So I think that would be, for people who have access to it, would be a good source. I would say that there's a lot of great communication coming up. I'm sorry, I don't mean to pander, but from BPHC and the Department of Public Health as well, and the CDC, of course. But, as we talk about many, and has been said, many people are not necessarily accessing or have access to those mainstream news sites. So I know in my own personal life, many of my friends call me, but not everyone has access to an infectious disease doctor or a commissioner of public health to contact. So I think that we need to search for improving the access. I would say that there's a lot of great news media available that I tune into every day, and many of the people in the audience do as well. But I think we're struggling to reach the people who are not necessarily tuning into this channel or to those news sites.
I want to ask you, Dr. Ojikutu, about some of the things that I hear, and actually you too, Dr. Pierre, if you can give me what your answers to them are, okay? So I'm hearing from friends and family, well, we're all going to get it. We might be now at this phase where we're all going to get it. Dr. Ojikutu, what would you say to people in your family if they said that to you?
Well, I would say first and foremost that there are a lot of unknowns about the Omicron variant. We know that it's highly transmissible, but we also know that infection is preventable. We know that vaccination and boosters do provide some protection against transmission. And masking, well-fitted masks, higher quality masks do provide protection against infection. I think these are important strategies. The other thing is protecting other people around you, particularly the most vulnerable people. And if we as a community are doing things like doing rapid antigen testing, if you have access and it's available to you prior to events, then you're protecting those people who are at those events. So I wouldn't give in and say, oh, we're all going to be infected. I would say that we should implement the mitigation strategies that we know are evidence-based and do them on a regular basis. And I think that many people will not be infected necessarily with this variant or any other.
How about this one, Dr. Pierre? I'd rather get it now than get it later because I've got plans coming up. And if I get it now, then I won't get sick again because I'll have more immunity.
Yeah, so I would agree that you should, even if you believe that this is an inevitability, we should not let this wash over us. I definitely disagree with getting it now versus later. Right now, we talk about the math as you did at the beginning of the segment. Even if it's experienced as a milder disease, particularly for those who are vaccinated, more cases means more opportunities for more severe disease, hospitalizations, and deaths. So in a crowded, overtaxed healthcare system where it might be difficult to even access tests, maybe difficult to access treatment, this is not the time to get sick. We should extend as much as we possibly can the opportunities to get the disease by doing the things that we know will help. What I would also say, though, too, to people who say this is, even as much as we need to continue to wearing our masks, physically distancing, getting our boosters to reduce the risk of infection, I also do tell people that just from a logistic perspective, it's good to know that you have a plan in place, especially with kids in school, for what to do if you have symptoms. So I think that's a really important piece too.
So I grew up, my mother was almost like a storm doomsday planner. We always had extra cans, we always had candles, we always had batteries, and I don't know if it's genetic or just wore off on me. I went and bought, the N95 masks early and stored them and kept them and started wearing them in November. Every time I saw tests, I bought them. And folks in my life have started calling me Santa COVID because I come around with the tests and I come around with the masks and hand them out. And I'm just wondering, this is obviously with us and going to be with us for a while. Can we start developing more people like me in other people's families? I mean, Dr. Ojikutu, do you have messages to people who are like us? I don't have a degree by any means in medicine, but I certainly know how to plan for an emergency. Is maybe this a good idea of trying to get community leaders, neighborhood leaders, kind of like ward bosses in the old days, to be in charge of keeping communities safer?
Well, I think that being a person like you is a great thing. I mean, you're the type of person, right? I think this is the type of person we need out there, particularly in times like these when people are tired. People are going to keep people motivated and thinking about the mitigation and prevention strategies. You know, we've already developed many community leaders who are leading the fight in regards to COVID-19, and they're out there, boots on the ground, knocking on doors, doing mobile activities. They were passing out our test kits. We passed out 180,000 test kits about 2 weeks ago throughout the city of Boston. They did a lot of that effort, and they were out there talking about wearing masks. They were giving out masks. So we have people out there who are doing this. They're spreading the word. The reason why we're at 69% fully vaccinated rate and 80% of our population has received one dose of vaccine is largely because of these community folks who are leading the way. So I would say that they're essential to this process, and the more people who are doing that, the better.
Dr. Pierre, can you talk a little bit? This isn't just a pandemic of people getting sick from COVID because of the challenges to our healthcare system. Many folks are not getting their usual vaccinations. Some people are putting off going to the doctors. Some things that you might want to get done, like even if you want to get an eye lift, you may not be able to get it done. Can you just talk quickly about how the pandemic is impacting that so that we can think about taking better steps to keep ourselves healthy?
No, it's actually very devastating. This is another component of the pandemic of the first wave I had hoped not to see again. Definitely people are foregoing or being rescheduled or delayed having treatment for conditions, more impactful perhaps than an eye lift. Right now we're seeing surgeries being rescheduled, maybe even some essential surgeries being rescheduled and delayed. Many places are experiencing that their outpatient services, the ones that we need to do our screening and preventive checks, to get our refills, those are also being delayed or rescheduled or turned into telemedicine visits. And luckily, we do have that option for those outpatient visits. But there's so many things where delaying that touch, that evaluation or the surgery can lead to bigger and more severe health consequences. We have seen in our hospitals in the past few months, more people presenting with more progressed malignancies, cancers, people coming in with new or worsened cases of diabetes. So many things that, while not directly, attributable to the virus, have been worsened by people's inability to get into healthcare. Yeah, so again, another reason not to get sick at this point.
I only mention the aesthetic because I'm trying to talk to people that may not think they're ever going to have a heart attack, but may actually want to get a nose job someday. So make sure that they're making sure that they're keeping themselves safe. Dr. Pierre, Dr. Ojikutu, I so appreciate both of your efforts and all that you're doing to try and keep us safe and healthy as we get into this new year. Thank you so much for your expertise, and thank you for joining us.
Great to be here.
Thank you for having me.
That's it for tonight. Tomorrow, tune in for Talking Politics as Adam Riley and his panel take up the politics of COVID in Massachusetts. With so much anger and finger-pointing over restrictions, perceived failures, and downright chaos, who really has the power to call the shots? And are they making the right decisions? Tomorrow at 7 on Talking Politics. Thanks for watching.